Hi, Dr. Lori Stevens here, and I'd like to talk about tartar and gum recession and how that relates um, to the body and the health and electron donors. So um, I learned some 12 or 14 years ago about the real science of our breathing mechanism, how we make and update our bone, and how that relates to gum recession and tartar in the mouth and even heart attacks. And so, and when I was in dental school, I was taught that we breathe because of a need for oxygen. But we really have the breathing mechanism in our primitive brain and the medulla oblongata. The respiratory center actually is driven by the tolerance of carbon dioxide. So if you think of a thermometer in your brain, when you get to enough carbon dioxide, then that drives the mechanism to want to breathe. And you breathe out carbon dioxide and then breathe in again. And the oxygen carbon dioxide exchange happens in the lungs. And that's really the breathing mechanism. Now, if you do extreme exercise, you can recalibrate that thermometer that is the sensitivity to carbon dioxide. Now, carbon dioxide is not a poison, like you've been told. It's not bad. And there are some exercises that you can do to optimize your breathing. So, what I have noticed, particularly in the last 25 years or so, is that people are breathing more and more. So, for probably 200 years, the normal, optimal amount of oxygen or amount of air we breathe per minute has been 3 to 4 liters. So, just about a gallon. So, if you hook your nose to a gallon jug of air, you ought to be fine for a minute. Well, over the last 15 years, especially 10 years, and it gets faster and faster, increasing. The total amount people breathe is really up to 2 or 3 or 4 gallons a minute. So some people, depending on your tolerance to CO2, you may be hyperventilating because of the toxins in our environment and our food and our medicine, electromagnetic fields, just even if fear and anxiety. So whether a toxin is a chemical, um, physical trauma, you get in a car wreck, you get hurt, you break your arm, break your leg, that's a trauma, that's a toxin, or it can be emotional or spiritual. If you have been hurt before and somebody threatens to hurt you again, that's still a toxin. So that all those things make you hyperventilate. So I tell my patients it's kind of like sitting at the stop sign in your car, you got your foot on the brake and you're pumping the gas, revving the engine, makes your gas mileage just terrible, your miles per gallon, because you're using up a lot of gas, but you're not going anywhere. So that's kind of like hyperventilation. So the way that has been so eye-opening for me over the last 12 or 14 years is gum recession and heart attacks. So a long time ago, 10 plus 12, 14, 15 years ago, a lady came in. She was under 50. I was in my 40s. And so she was a little older than I was. And I said, "Hey, how you doing?" And she said, "Well, I've had a heart attack since I saw you last." And immediately my mind went to, she always had a mouthful of tartar, always, but she was a yoga instructor and a swimming instructor and, ate, yogurt and things like that before it was really popular. And so I noticed in my mind, I thought, she's also in the fastest growing heart attack victim group, which is women under 50. And I was in that group at the time. So that was an aha moment for me. And then when I found out, in fact, I had a patient who told me, "I need to teach you how to breathe." And I kind of passed her off and I thought, well, whatever. Well, then um, I found out that I had sleep apnea. and thought, okay, well, maybe this is something to this breathing thing. Maybe I need to look into this. So I did and investigated different groups that teach breathing exercises. And thank goodness I got the one that had the most scientific background with the longest history of clinical success, double-blind study that said, yes, they really do improve your health with changing that, resetting that thermostat, the sensitivity to carbon dioxide, which drives our breathing mechanism. And it's the classical Buteyko method. And the group that I studied with, I found instant results and learned during my investigation of their scientific research and documentation that basically tartar in the mouth is leftover residue when you've used the bone that's always liquefying and solidifying in the mouth. The bone is always turning over faster in the mouth than it is in long bones. So when you use that bone as it turns over, and it's like withdrawing out of your bank account without putting a deposit back in, when you use the calcium out of that bone that's turning over in your mouth to buffer the pH of the blood, which is a more vital necessity that that blood be the right pH so your heart can beat. That's more vital to life than having bone around your teeth. When I found that out, that if the body hijacks that calcium to buffer the pH of the blood, that's where tartar comes from. The residue left over is the tartar. That also is the reason for gum recession. So I started in dentistry in 1980, and I noticed through the years, I was a hygienist first, so I noticed through the years that petite women are, in my observation, the most well-groomed, conscientious, um, conscientious in dental home care and also conscientious in, being on time and their kids are well behaved and whatever. It's just a personal observation that petite women, um, they follow the rules, they do what I ask them to do. Um, they just are a very conscientious group of people. Anytime you generalize, you're going to offend some group, or it's not. I've just noticed that petite women are very conscientious flossers. They take care of their teeth. They come to their dentist visits regularly, and yet they have the most recession of any group of people. Any other group of people that I have seen, um, petite women have the most gum recession, which goes along with the fact that we make our carbon dioxide with muscle activity. And petite women, there can be thin men also who also have more recession than bulky, stocky men because of the muscle mass. So people with less muscle mass or people who are not really active will have more gum recession, particularly people with sleep apnea will have more gum recession than people who are very muscular and who do a lot of muscle activity, because that creation of the carbon dioxide buffers the pH in the body so you don't use up the bone in your mouth to buffer your blood, because that's the first thing that needs buffering when we're acidic. And we make our pH by breathing the 30,000 times a day we breathe, that carbon dioxide oxygen exchange, which is now we know dictated by nitric oxide and how that works, how open the blood vessels are, how dilated the blood vessels are, and that oxygen carbon dioxide exchange actually is dependent on nitric oxide, and the blood flow and anywhere that oxygen carbon dioxide exchange happens is nitric oxide dependent. But in the mouth, if there's an acidic pH and the body is hijacking that calcium out of the bone being continually turned over in the mouth, then the bone will dissolve out of the mouth and the gum recedes to go with it. So gum recession happens in people who really don't have gum disease. I mean, they might, but that's not the cause of recession. The cause of recession is not brushing too hard. It's not grinding your teeth. It is actually osteoporosis that starts in the mouth because, by definition, you're using that bone to buffer pH instead of using it to support your gums and teeth. So that's the reason. That's a long, drawn out explanation for how gum recession actually happens. And the correlation between tartar in your teeth happens for people who are hyperventilating, who have an acidic pH, and that hyperventilation drives the inflammation that creates all disease, really is inflammation driven, provided it's not a congenital defect or something. So, a DNA issue or something like that. But what they call diseases of civilization, anything that you see a prescription on TV for, then if you write your pH of the body, those diseases will fall away because the body is innately self-healing. So that's a long, drawn out explanation about how breathing creates your pH and creates all of the biochemistry downstream from the actual carbon dioxide exchange of what our blood pH is. Every tissue, every organ has its own preferred pH, and it's dependent on how we utilize the carbon dioxide and oxygen, and the rate, how much we breathe per minute, is the telltale sign of if we're going to have disease. It's a great predictor of if we're going to have disease or not. It's a great predictor of if we're going to heal from disease. So when I treated my sleep apnea with these breathing exercises from the classical potato method 12 or 14 years ago, maybe more, I don't remember now, I got rid of 32 disease processes, one of which was hyperextension. So my arm could bend backwards and my knees would bow backwards. I had TMJ, I had scoliosis, kyphosis, um, lots of tendon issues. And now I don't, because after years of having a normal optimal pH, my ligaments have tightened up. So I no longer have TMJ. I no longer have hyperextensive joints. I have much, much less knee or back issues. Had a lot of issues as a kid, and really through, well, I was probably in my late 40s, probably by the time I did the classical potato to treat my sleep apnea. So this has all happened um, older, actually, in my adult life. And so I had exercise-induced asthma, chronic constipation, which is now we know a predictor of having Parkinson's. Um, I had um, 9 kinds of cysts. I had, um, gosh, I have forgotten all of the things that I've gotten rid of now. But anyway, lots of different diseases. So insomnia. I had probably 35 plus years of sleeping about 4 hours a night. And the first class I took, that really was uh, like a great night of sleep. I remember I've had other nights of sleep. I won't say that was the first night in 37 years I slept all night, but it was one of the greatest nights of sleep, and I sleep great now. And I do some other things too. We know a lot more about diet and exercise and those kinds of things now, but I'm much healthier now than I was predicted at one time. I was told I wouldn't live to be 50. So at almost 64, I'm feeling really good. So that was much more than just gum recession and tartar, but you can tell that I'm very interested in these subjects. The fascination for me has not waned as far as how the body works, and teeth and gums are still very interesting to me. And I will bring you some more information here soon.